Well, hello everyone. So first I want to thank you for the opportunity to present this work here. And today I present this paper that Iñaki and I have been working on. So I'll comment, it's very welcome. Cause of the diversity index measure the extent which some populations die from more similar or more disparate causes than other. And so high heterogeneity and cause of that means these causes are very different between each other. And this can imply that it's hard for us predict the deaths. So high cause of the diversities can imply huge problems and huge challenge for health policies. And because of that, in the last few years, because of that, indicators have been recognized like very important measures of population health and provide new perspectives on our understanding about mortality dynamics. Several attempts have been made to measure diversity in mortality by cause of that. And although this studies, it's very important to disseminate the concept of cause of death diversity. This approach never have attempt to assess how much this diversity can explain for different subgroups in the population. So, in this paper, we propose a new method to decompose overall cause of the diversity as a sum of two parts, the between and the within group components. And to illustrate how you can use in this new approach, we apply this decomposition in the Latin America and Caribbean context, one of the regions with the highest health inequalities in the globe. Specifically in this paper, we using the Simpson Index of Diversity to measure cause of that diversity, and basically it's a very simple and easy to interpret. So this index, it's a probability of you choose randomly two deaths if they are from different cause of death. So lowest values of diversity means low diversity, and high values of this indicator means high diversity. And we propose so decompose this indicator in two parts. The first part is the within component that measures the diversity into each group. In the second term, it's the diversity between groups that measure the difference in cause of death profile between the groups. In our case, the groups here, it's the Latin American countries, and both terms are weighted by the population size. In this case, it's the proportion of deaths of each country in the total mortality in the region. But this decomposition also can be written in the matrix notation, where in the diagonal we have the within terms, and off the diagonal we have the between terms. So finally, to finish this methodological part, it's also important to assess how much a specific cause of death or a population subgroup or a cause of death together with a population subgroup can contribute for cause of death diversity and for these components. In this presentation, I focus only in the population subgroup contribution because of the time. So we're using the mortality information from World Health Organization for Latin American and Caribbean countries. All that is included here, so these data were classified into 18 groups of underlying cause of death, and we working with 21 countries that represent 85% of the total mortality in the region. So here we have the cause of that diversity for each one of the countries we analyze over time. For men in purple and for women in orange. And if you can see here, most of the countries show an increase in diversity over time. But for very specific countries, especially they locate in Caribbean, like the islands in Caribbean, we can see a lot of oscillation because of the small numbers with each group of cause of death. But in general, this is one of the regions in the world that we can see an increase in diversity. So all the trends for the countries can be translated in the increase also in the overall cause of the diversity for the region, especially after 2005, 2006, especially for women than for men. So the diversity in the region increased a lot, and it happened especially because of the reduction in cardiovascular disease mortality and the increase of the participation of other causes of death, like, for example, cancer. But on the other hand, even the diversity increase over the time in the region, the between component, it's 70% over the time. That means the difference in the cause of death profiles explain more the diversity in the region than diversity within each country. So here we have the metrics for women in 2000, and in the diagonal we have the between component, and if you don't wait for the population size, it's the same of the diversity for each country. So this is another way to see the previous chart. So here we have El Salvador and Peru, like with the highest diversity in the region for women in 2000. But if you see in 2018, Brazil and Uruguay also enjoy them. And if you look below the diagonal, you can see also El Salvador and Peru with highest contribution for between component. And in 2018, Uruguay enjoyed them to contribute for the between component for diversity in cause of that. And why I'm thinking a lot about why these countries, it's so different for the other countries of the region. So I not present here the results by cause of that, but the explanation, it's different for each country. So for example, El Salvador present a highest prevalence of mortality by external causes, while Uruguay have a low prevalence for mortality by cardiovascular disease and high prevalence for other chronic conditions. So because of that, the countries, it's very different between the other countries of the region. So the metrics can summarize in the contribution of each country for the between component, the between in the total. And here we already wait for the population size. So Brazil already have one of the highest diversity in the region, but when we wait for the population size, Brazil have a huge contribution because only Brazil represents 14% of the deaths of the regions. But together with Brazil, we can also see Argentina, it's the first one in the top after Brazil, and Mexico, because the countries have a huge population size compared to the other countries. And here are El Salvador, Peru, and Uruguay have small contributions, even for the between component, because the population size is smaller if you compare to Brazil, for example. So discussion. Cause of that, heterogeneity can be an important indicator for population's health and inform more about how we can predict that. And because of that can be a very important ingredient for elaborating policy publics. We can think more how this can improve longevity. This new approach I present here allowed us determine the source of diversity in populations and provides us very important tools to identify and reduce health inequalities. In summary, the difference in the cause of death profiles in Latin American countries explain more than the diversity between the countries. And this happened because even though Latin American countries experience a high prevalence of chronic condition mortality, the concentration around some causes vary a lot between countries. So, for example, cardiovascular disease death corresponded from 20% of 40% of total mortality, depending on the country. And these result a very different cause of death profile for each other. And we think the application of this type of methodology can help us to have more information about mortality profile and have some insights for public health policy. So thank you.